And welcome to another edition of the David Tomsic Show, where we fight tyranny one day at a time. Now, I hope you're all well, and I mean that sincerely. I have a whole list of people I pray for every night that are not well, that have some issue, mental issue. Some have dementia, Alzheimer's. I know people with fighting cancer. There's all sorts of problems many people have. And I know a lot of people that have these issues that fight every day to stay alive, to stay healthy. But our healthcare system is ill-equipped to handle the issues of today. We found that out during the pandemic of 2020, didn't we? Not prepared. Chaos. It took individuals, all those nurses, all those doctors, all those people that sacrificed to be on the front lines for all of us when the government and its systems failed us. Big time, Donald Trump. But right now, we're in another crisis. Healthcare and the system that we call the healthcare system is in trouble. Now, Obama, back in his day, created the Affordable Care Act. It's now known as Obamacare, or has been known as Obamacare. It was not a perfect solution to the problem. In fact, Obama says, and he quote, Obamacare has real problems that have been exacerbated by congressional gridlock and polarization. Now, he also went on to say that basically Congress refuses to fix what was wrong with the Affordable Care Act. They refused because of the gridlock, because of polarization. And of course, we know that right-wing people, conservative people, religious people are more than happy to eliminate the Affordable Care Act. Now, Donald Trump back in 2016 said we must eliminate the Affordable Care Act. It's destroying America. Untrue. See, he hates anything anybody else has done. Now, basically, the Affordable Care Act was a keystone to the Obama administration. It helped millions of people, no matter how flawed it is. It gave people who did not have health care coverage. Now, I mentioned people that I know that are ill, that are sick. I myself fought cancer. Without the care that I got from the system that was in place and the very fact that I was able to get to that system, to utilize that system, helped me survive. Many people will die without being able to receive treatment because they have no health care benefits. They don't get regular checkups. All these things are happening right now, and it's going to get worse with this new big, beautiful bill, the biggest, beautiful, best bill in history, where it's going to cut Medicaid. But we don't care because everybody's a crook and a thief, and we're only going to have deserving people. Deserving people are the ones that deserve health care. They're the ones that are going to get it, only deserving people. You deserving? I can tell you some people that have health care right now don't deserve squat. Useless humans. Hateful humans. But they have it because, well, they're in the right place. They're white. They have a job that offers it to them. I know people working 35 hours a week don't get any benefits at all because the company's not going to offer it to them. They're allowed to. Unless you're 40 hours, you don't have to be offered it, depending on how many employees you have. All these stipulations. But to me, America, the America that I believe in, provides health care for all. We're a big country. Why shouldn't we be able to? Others do, and don't go down the road. They're terrible. People are dying. They're waiting in lines. That's not all true. The fact is that no system's perfect, but everyone deserves health care. A child, all the way up to a senior citizen. They all deserve health care. But our health care system's broken, and Donald Trump wants to break it some more. So the Affordable Care Act came about, and of course, Donald Trump hates it. He wants to replace it. So back in 2016, the numbers came in. The repeal of the Affordable Care Act without a suitable replacement would increase the number of uninsured people by 18 million in the first new year of the plan. Later, after the elimination of the Affordable Care Act's expansion of Medicaid subsidies for insurance purchased through the ADA marketplace, That number would increase to 27 million and then to 32 million in 2026. So back then, we realized that if you get rid of the Affordable Care Act and don't have a suitable replacement, the numbers of uninsured people would skyrocket in the next, really, 6 years. Well, we're there now. No, he has not repealed the Affordable Care Act yet. What he's doing is he's chipping at it through Medicaid. They basically had a reduction to Medicaid under this big, beautiful bill. Big, beautiful. It's a big, beautiful bill. Big. Some people are just sitting there drinking a beer going, I'm glad that big, beautiful bill's in place. We're saved now. The world is safe for white people. At any rate, so you have this attack now on Medicaid, $790 billion cut, I think it's what it is. And it hasn't been passed yet. It might go through the Senate. Looks like Rand Paul's going to cave in. And of course they all are going to cave in. It's the plan. It's always the plan. The plan is never to help poor people. Understand me now. Poor people are not part of the plan here in America. We ignore poor people. If you're living on the fringe of society, you don't exist to people like Donald Trump and the Republican dirtbags that are now in Congress. The fascists, you don't care. And to many Democrats, you don't care. Remember that. Remember that, people. Many Democrats haven't fought for you either. They were worried about all kind of other issues leading up to the 2016 election, but they forgot about the people that may not donate to their party, that may not go out and vote. They're not concerned. As homelessness increases, it was 18%. It's going to increase and keep increasing as the cost of housing, the cost of renting go up and up and up. You don't count if you're poor. You don't count really if you're a minority. You definitely don't count if you're an immigrant. So why bother? Why fund Medicaid? Why help anybody? Only deserving people should get Medicaid. Here we go again, deserving. Now, by whose definition? You see, that's the other problem. Deserving is ambiguous. Who's deserving? If you're working at a minimum wage job compared to not working, compared to not able to work, listen, I believe this. No matter what, people should be able to access quality health care, life-saving medicine. Many people can't. They don't. They're afraid of getting the hospital bill. I saw the cost of cancer treatments. I see how people are going down to the pharmacy right now and not picking up their prescriptions because of the cost. I use Restasis because I have contacts and I have very dry eyes, very dry eyes. I was paying $59 last year. This year, because of some changes made, this was probably under the Democratic leadership of Joe Biden and his crew, the cost went up to $500, $600. It's, if you get enough, you can use it against your deduction. I did not pay $600. I fought with my eye doctor. Finally, they found some generic form that I can pay $100. Yes, $100, and that might last me 2 to 3 months, maybe. Doubled from what I was paying last year, just about. Now, other people might not even have went and picked it up, won't even call. They're done. They can't get their medication. Listen, this is the 21st century, people. What happened to the dreams of all these dreamers that said we're going to have this basically new society where everybody's helped, where there's nobody sick, where everybody's going to get help, and all these things everybody dreamed about never going to happen. Because guess what? Most of the people that you think about don't count. Poor people. Guess what? If you're already sick, pre-existing conditions, that's what Trump wants to do. Well, we don't cover pre-existing conditions. Okay, so where does that person go? Most of you don't care. Most of you on the right don't care, that's for sure. You see, because it's always about money. Always. It's money. You go, well, yeah, it is about money. It never affects you, does it? It really doesn't. Most of these things that everybody cries about, immigrants, LGBTQ plus people, trans people, go down a list of items that everybody cries about, very small percentages of our society. These people are more worried about that than they are about people that can't get health care, people whose children can't get proper health care for childhood cancer, people who are dying in homes, crappy homes, because insurance won't pay for them to get real rehabilitation, to really be taken care of. No, we don't care. Out of sight, out of mind. Remember, Donald Trump had a new plan for homelessness. Move them out of the cities and into some rural area. I don't see him anymore, so problem solved. Win for Donald Trump. So I want to take a break here and let you know that we have a sister channel called Nights Around the Fire. It's a channel that's dedicated to investigating myths, legends, and mysteries around the world. From Bigfoot to UFOs to ghosts to the Loch Ness Monster, whatever it is, we're going to investigate it. It's hosted by me, Ashley Hamilton, and Sue Taylor, our two researchers. It's a great channel. If you enjoy those types of things, go over to that channel. I have a link in the description box, Nights Around the Fire. I hope you enjoy it. So let's fast forward to 2025. Medicaid cuts are coming, about $780 billion worth of them. This is going to push a lot of people off the rolls. If you're not deserving, then you don't deserve Medicaid. You don't deserve health care. You probably deserve to die then, I guess. I guess that's the end of this, right? I mean, you can't just say, hey, listen, it's raining outside. We don't allow you inside, so I guess you're going to go outside and stay in the rain. Well, that's where we're at with health care. You have cancer. We're not going to pay for it because you don't have insurance, so just go out there, and whenever it is, you'll die. And then that problem is solved, right? Is that the Trump administration and the right-wing answer for it? And many Democrats? Sounds like it. So a recent report said that 742 rural hospitals are at risk of closing, with over 300 of them considered at immediate risk, and proposed Medicaid cuts would push them over the edge. Now, in rural Colorado, Medicaid cuts would affect San Luis Valley Health System and its economy. 50,000 people could face a total shutdown of health care. 40% of these people have Medicaid or on Medicaid. So the CEO of San Luis Valley Healthcare Systems, Connie Martin, said that when people lose their health care coverage, they don't lose the need for health care. Many of them will wait till later in their disease process, wait till later in their illness, then show up in our emergency room. It will be a crisis on our healthcare system. We are a rural hospital, don't have the resources to take care of them, so that it would be devastating to them and the healthcare system, and would be devastating to many of our peers as well. So what does our government say about this? Medicaid and Medicare Service Administrator Dr. Mehmet Oz says that any deserving Medicaid recipients will be shielded under this plan. So the question was posed to Connie Martin. She was asked, so who does the government consider deserving? She says, I'm not sure. It's very unclear right now. But I will tell you that since the 2020 pandemic, there have been 575,000 people that lost their Medicaid coverage. We call it in Colorado the unwind, and that's what we've been seeing. The great unwind, huh? Just unwind the process. Let it all collapse. She said in our valley, we've seen over a 40% rise in emergency room department coverage. In her part of Colorado, she said that many deserving patients lost their Medicaid coverage due to administrative issues and through the Medicaid eligibility system. The process to qualify for Medicaid is extremely complicated. So why is this? Why has everything got to be complicated? How do we really help these people? Well, if you thought about it, you'd find ways to make it easier for people to access health care, to file federal forms. But instead, we went backwards, with Elon Musk and Donald Trump pretty much wrecking the federal bureaucracy. There are less and less people involved, less and less people to answer phones, whether it's at the VA or even the IRS, or for that matter, all these other agencies that are there to be a safety net for people. What have we done? Is that the plan? Is that really the plan? Just to make sure no one can actually apply? if you can get 10% of those people that need health care not to apply for it, you don't have to pay for it. Is this what America is now about? Money? And I always said that it'll always go back to money. Even those right-wing middle-class people who don't have money, it's still about the money. They will never see that money. They will never get any reimbursement of that money. They will never have their taxes really cut. They will never see a real benefit from hurting other people. But they'll let it happen anyway because they've been told we have to do it. We have to do it. We have to make sure poor people and people on the edge of society don't get benefits because we're going to save money that way. Because we're going to give that money to rich people. And again, those right-wing people and many left-wing people don't seem to get it. All this is about cutting money we spend elsewhere and giving it to rich people. How stupid can we all be? That's where it's at. And Donald Trump is the epitome of that. Because again, there's no secret who he really is. Never's been a secret. It's just that people have had blinders put on. People have had the illusion that somehow he cared about America. But he only cares about the America that works for him. And that's the top 10%. The rest could go somewhere else. The rest can be lost in the numbers. It doesn't matter. As long as he makes people believe he's making America great again, that's all that counts. Except for the people who will never see a great America. And it's always the same people. Minorities, immigrants, the poor, the homeless, the helpless. Those people aren't counted in the numbers. We don't worry about that. We should care, America. We should care about those that don't have anything. We should care that they are taken care of as well, that their children have access to health care, that no one's left to die when they could have easily been saved. That's on us. We need to stop worrying about money. We need to stop worrying about rich people who don't pay taxes. And we need to start worrying about the least of these. That's what I believe America's about. Reaching out and helping. Showing the world that we care for people. And make more and more people want to be like us. That's all the time I have. God bless you. Don't forget to like, subscribe, and share this video and all our videos. Make sure you go over and check out Nights Around the Fire. I'm sure you'll like that channel as well. And beside all that, we'll be back tomorrow with more news, analysis, and commentary right here on The David Tomsic Show. Fighting tyranny one day at a time. Join the revolution.